For the procedure, remember the acronym CPAC. C. Check. Check records, medication record, or obtained an order if necessary. Medications the client is receiving because certain medications may hamper movement or alertness of the client. Determine the assistive devices that will be required. Determine the hindrances to movement, such as an IV or an indwelling urinary catheter. P. Procure. Obtain signed informed consent if needed. Obtain assistance required from other healthcare personnel if needed. A. Aseptic technique. Wash hands and don procedure gloves if needed. C. Collect. Obtain essential equipment before starting. Example, gate or transfer belt, wheelchair, and check that all equipment is functioning correctly. When approaching the client, remember the acronym CARES. C. Connect. Introduce self and instructor to client. Identify client, read wristband and ask client to state his name. A. Assess. Make relevant assessments. Takes vital signs to ensure that the client still requires the procedure, can tolerate it, and that there are no contraindications. R. Rationalize. Explain procedure to the client, including what he will feel and is expected to do. E. Establish privacy. Provide privacy. Ask visitors to step out drapes appropriately. S. Support. Use good body mechanics, positions bed accordingly.
Good day, ma'am. I am Carla Sinadiano, your student nurse for today, and these are my co-nursing students who will be helping me in this assessment. So this is Miss Valerie Tabase, Miss Ena Juntipon, Miss Lucille Gernaldas, Miss Shanice Ashley Gayakaw, Miss Esther Grace Bayongan, and Miss Nolene Dorimon. So we will be starting this procedure. Will you be able to cooperate with us? So let us start.
During the procedure, remember the acronym CARE. C. Control infection. Wash hands before touching the client. A. Aesthetic. Maintain correct body mechanics. Perform procedure with acceptable style and art. R. Risk protection or safety. Explain rationale of procedure to the client. Provide client safety. Keep side rail up on a far side of bed. Continue to observe the client while performing the procedural steps. Remove obstacles from the area so the client do not trip. Make sure there are no spills or liquid on the floor on which clients could sleep. E. Efficiency. Perform procedure in an acceptable period. Demonstrate coordination in handling equipment. Follow correct procedural steps. Step 1. Adjust the client's bed in preparation for the transfer. Lower the head of the bed until it is flat or as low as the client can tolerate. Place the friction-reducing device under the client. Raise the bed so that it is slightly higher, 1/2 inch, than the surface of the stretcher. Ensure the wheels on the bed are locked. Place the stretcher parallel to the bed next to the client and lock the stretcher wheels. Fill the gap that exists between the bed and the stretchers loosely with the bath blankets. Step 2. Transfer the client securely. If the client can transfer independently, encourage him or her to do so and stand by for safety. If the client is partially able or not able to transfer, one caregiver needs to be at the side of the client's bed, between the client's shoulder and hip. The second and third caregivers should be at the side of the stretcher, one position between the client's shoulder and hip, and the other between the client's hip and lower legs. All caregivers should position their feet in a walking stance. Ask the client to flex the neck during the move if possible, and place the arms across the chest. On a planned command, the caregivers at the stretcher side pull, shifting weight to the rear foot. The caregiver at the bedside pushes the client toward the stretcher, shifting weight to the front foot. Step 3. Ensure the client comfort and safety. Make the client comfortable, unlock the stretcher wheels and move the stretcher away from the bed. Immediately raise the stretcher side rails and or fasten the safety straps across the client. After the procedure, remember the acronym CARED. C. Check. Check client's response to the procedure. Check if client is comfortable, safe position with call light within reach. Returns bed to low position and raises side rail if client requires this precaution. A. Aftercare. Remove extra equipment or materials used during the procedure. R. Rewash. Wash hands again before leaving the room. E. Evaluate. Evaluate client's general status in response to the procedure. Compare client capabilities such as weight bearing, pivoting ability, and strength and control during previous transfers. Report any significant deviations from normal to the primary care practitioner. Note use of appropriately safety measures. Example given, transfer belt, locking wheels of bed and stretcher. By UAP during transfer process. D. Document. Document that procedure was done and all relevant information.